Good morning. Welcome to today's discussion entitled Golden Years and Budget Fears, Aging in a Changing New York. I'm John Lentz, Editorial Director at City and State, and I'll be moderating today's legislative forum in partnership with AARP New York. We're just days away from state budget deadline, and there are a lot of issues still in play. We've been hearing about a mask ban, tweaks to discovery reform, limits on cell phone use in schools. But today we wanted to dig into a few other measures that perhaps haven't gotten as much attention, but could have a major impact on the over 50 population in New York. During today's discussion, we'll hear from lawmakers, experts, and advocates about New York's aging population and what policymakers are looking to do. With the state's $200 billion plus budget due in just 1 week, it's a very timely topic. I'll start out with a question for each panelist, and each panelist will briefly introduce themselves and the work they do. Then we'll pivot to questions posed to the panel as a whole. If we have any time at the end, we'll try to take a few audience questions, but only as time permits. Without further ado, let's jump right in. And I wanted to start with Jonathan Bowles. Your organization, the Center for an Urban Future, has partnered with AARP in documenting the changing demographic landscape in New York and what it means for older New Yorkers. Could you start out by setting the scene with some of the key takeaways from the research you've done?
Absolutely, John. And thanks so much for having me here today. Well, first of all, there are 3.56 million older New Yorkers today. That's not just the over 50 population. That's just people age 65 and over, 3.56 million. That's more older adults in New York than any other time in the state's history. And it's actually more than the entire population of 21 states. So there's a booming older adult population in New York. It's happening in every corner of the state. But our new report that we did with AARP shows that it's not just the booming older adult population and the growth of that population that we need to be concerned about in New York. Is that an alarming number of older older adults across the state are financially precarious today. Statewide, the number of people 65 and over living in poverty surged nearly 50% over the last decade. That's far outpacing the 30% population growth that we saw in older adults. So today we got 423,000 older New Yorkers, people over the age of 65, who are living below the official poverty line. That's 1 in 8 older New Yorkers that are below the poverty line. And so that alone is shocking, but we found in our report that there's several other things to be concerned about when it comes to economic security of older New Yorkers. And I'll just mention one last thing before I stop. Too many people across the state, not just those who are officially poor, are wholly unprepared for retirement today. In fact, we found that 49%, so just about half of all older adults in the state, reported no retirement income at all in 2022. That includes more than 50% of the 65 plus population in Buffalo, in Syracuse, in Rochester, in Yonkers, and in New York City. I think kind of where I end on all this is that we're heading toward a financial security crisis for older adults in New York. It's something we need to pay more attention to, something we need some policy interventions, because if we don't act, we're going to see so many more people in their 70s and even beyond that are working, not because they want to, but because they just have to put food on the table.
Great. Thank you, Jonathan. We have 3 lawmakers on our panel today. We'll go to them next. Assembly Member Sarah Clark will be joining a little bit later. And we do have Senator Leroy Comrie as well, who will be leaving a little bit earlier. But I want to start with Senator James Sanders, who is the chair of the Committee on Banks. Senator, one proposal in the state budget would train bank tellers, broker-dealers, investment advisors, and others on identifying questionable transactions that could be the result of a scam and also allow them to halt it. And again, this is, we've heard about older New Yorkers who are in poverty. This is something that really could affect any senior citizen in New York in particular. Can you fill us in on this measure and also assess the chances for its inclusion in the state budget this year?
Yes, good to be here. Good to all the other panelists. The subject is so timely because as America ages, we are discovering that the crimes against the elderly are escalating. Many of these crimes are sadly financial. And therefore, as chair of banks, I have a responsibility of ensuring that the well-being and indeed perhaps the very lives of our elders needs to be protected. One way of protecting people is to train people who interact with the elders. And one of the people who do this type of interaction are, of course, the financial industry. Anybody who, the banks, the money centers, anybody who is moving money to and fro. We're often, everyone's hearing the complaint of some elder who was taken to the bank by some unscrupulous person, their whole account practically taken out either at one stop or over time, and now they are just a burden to themselves and society and their families. Imagine if we could stop that. Imagine if we can train the tellers, train all of the people who interact with our elders of the warning signs of things to look for and to use their own discretion to bump it up to a higher level and say, wait a minute, you got to pass this and you got to be screened that way. We would save a lot of energy, a lot of taxpayer dollars if we did this. And this is what this new bill is proposing. And I believe that we have a good chance of passing. I believe that the industry itself, the financial industry, has some concerns, but we are trying to work with them to overcome this and make sure we protect our seniors.
And specifically, do you think that could make it into the budget this year?
Absolutely. We have been diligently working with the industry and working with others. And the problem is so vast and so acute that not to make it in would be a telling indictment of all of the legislators.
Got it. Thank you, Senator. We may have time to circle back to that later on in the discussion. I do want to get to Senator Comrie. Again, I'll have to cut out a little early here. Senator Comrie is the chair of the Corporations, Authorities, and Commissions Committee. One issue you're focusing on is keeping utility costs in check at a time when those are going up. That can really affect the older population in New York as well. How are you planning to achieve this, and how would this help seniors?
Thank you for allowing me to be on the program and talk to with the AARP, looking at how we can help our seniors. I'm deeply committed to making sure that the aging population in our state get more protections than ever before. There's a range of challenges that they face, especially with utilities. As you said, we have a bill, Senate Bill 4432, which would place a discount on home heating services, gas, electric, and gas, electric, and to make sure that and oil, to make sure that they can get an opportunity for discounts on their bills, especially during the struggling cold winter months. There are some programs, but they always run out of money. We need to make sure it's codified in the state. We also have my office, because of the deluge, we have a representative from HEAP that comes to my office twice a week to work with seniors on their bills. We also work with the Public Utility Law Project. We have continuing relationships with all of the utilities to try to make sure that seniors can stay in their homes, because we have a lot of seniors in our Southeast Queens districts, between myself and Senator Sanders, that are house rich with cash poor, and they're not able to meet the incomes because of the rising costs. We're also working to make sure that we keep people from being kicked off HEAP. We're working, as Senator Sanders said, another bill that I just got passed, death from the elderly, transfers especially, is another thing that is happening on a very high rate in our district. So I just had one bill passed this week or last week, Bill S5177, which required notaries to keep official records, because we have a lot of illegal, unscrupulous management companies that are coming in and creating a false record of a person's ownership of a property. As you know, in Queens, we've had more than one case of folks that have claimed they have ownership in a house that they had no participation in purchasing, but they just saw that the house was empty. We have a lot of folks that are consistently monitoring the registration, the New York Department of Finance registrations to look for people over 65, and they are sending people to their homes to intimidate them into signing short-term loans, or intimidating them even higher and pushing them out of their homes. That's something else that we're going to work on with the district attorneys. There's a lot in this space. We're looking at studying the seniors who have filed for bankruptcy. We're trying to create an opportunity to make sure that we push back to help give them more health care. But the issues on deed theft and as James said, banking theft are the two critical issues. And one other critical issue that we all are dealing with is the CDPAP issue, where we are dealing with home care for seniors, and the issue with the governor with this terrible contract that she put with PPL, which is truly harmful, an organization that has a bad track record, that we just found out was given a contract without a minority MWBE set aside, without proper, we're finding out that they're also doing their payments illegally in violation of labor laws. There's a lot that's happening, but the primary issue right now is that they can't even register all of the people that are eligible for the program. The governor created a pause, but looking at that pause and looking deeper at PPI, or I think PPL or whatever their name is, they need to revoke that contract and restart the program and let our seniors stay where they are in a protected space where they're being well taken care of right now. There was no problems with the level of care. There was a problem with the government understanding that they could not keep up their level of responsibility or tracking. And in this age of computerization, that's ludicrous, and we need to stop that. But I want to thank City and State and AARP for bringing these issues, and we look forward to continuing to work with AARP to try to protect the lives of the people that laid the path for us to be here. And so we all have a responsibility as legislators to protect them. Thank you.
Great, thank you, Senator. And obviously, big issue there was CDPAP. We will be able to get to that later in the discussion. Just want to get a couple more details from you. Again, on the utility issue, you talked about effort to get some funding for discounts. I guess, how much money are you looking at? Would that presumably need to be done in the budget to get more money to help people afford utility bills?
We would like to get more money in the budget for HEAP and give more money to Pulp so that they can continue to do the great work that they're doing. But not everything doesn't necessarily have to be in the budget. We are also, Public Service Commission is looking at rate increases for all these utilities. That other things that we're looking at. Why are the utilities why are they adding the taxes that they have to pay to the state against the consumer? There's a lot that they're doing that we have some issues with. They should be paying taxes out of their profits, not asking the consumers to cover that money. There are other things that they are making consumers pay, that it's increasing the amount of money that a consumer has to pay. We also have to be careful because Washington is now talking about eliminating opportunities from Canada, where we're getting a lot of our electrical transmission from. We need to push back on that. But primarily for seniors, we're asking the utilities to improve their amount and freeze dollars that they are paying, that these seniors have to pay, because they are not getting, they're not getting cost of living increases at the rates that these utilities are trying to increase bills. So there's no way that they can keep up. So we're asking seniors to exempt them. We're asking the utilities to exempt seniors on their bill rates, and to keep a consistent bill rate, and also to provide free NYSERDA services to those seniors that need to understand how to have a more energy efficient home. And then that's a whole nother topic that I could delve into that Senator Parker's been working on, to try to make sure that NYSERDA and the energy companies come in and with homeowners to help upgrade their homes so that they're using less energy.
Now, you mentioned the Public Service Commission, and they do review these rates. Is there anything you feel like the Public Service Commission should be doing differently, or is there any legislation you want to pass to change how they you know,
Actually, right now at this moment, there's a press conference that two of my senators are doing, Senator Mayer and Senator Skoufis, regarding the Public Service Commission, asking them to be more responsible. We're going to hold a roundtable discussion tomorrow in room 944A at 11 o'clock for anybody who wants to talk about this. There's a lot of things that the Public Service Commission needs to do better to take care of our consumers and to even push back on rate cases, because they have not been aggressive in even addressing the needs of trying to contain some of these utilities rate cases. So there's a lot that we feel the Public Service Commission needs to do better. And I would go through a list, but we don't have enough time.
great. All right, thank you, Senator. I do want to pivot to Assemblymember Sarah Clark, who has joined us. She chairs a subcommittee on tuition assistance program. And Assemblymember, I know you've focused on a lot of different issues, prioritizing the lower cost of living in various ways, tackling financial exploitation of elders, which we've hit on already. But I did want to ask you first about the state's long-term care ombudsman program, which is also a priority of yours. We've seen some funding increases in recent years for this program, which provides some oversight and accountability in nursing homes. What's the push this year, and why is this important?
Yeah, I think the ultimate push is there's a $15 million fully funded sort of ask to get to the point where we're, for the long term, for those who may or may not know, the Long-Term Care Ombudsman is a very successful program to really embed advocates into our nursing home facilities and other places where people are living and receiving care. And it is the number one way we can help really advocate for safety issues, health issues, but also in many cases just settling some disputes or figuring out a path forward when people are feeling frustrated about something that may not rise to the level of a true safety concern or hazard. But we know the program really needs visits monthly, if not weekly, at all our facilities for this to work. I mean, for you to trust someone who's coming into your building to advocate for you when they leave, and knowing that you're now at the mercy of the staff and those who may feel that they've, been told on or whatever it may be, is that they're coming back, right? Is that there's this constant visitation to build that trust so that you feel like you really have a great advocate. What we know is the program in terms of true safety violations only works when we have, staff doing it. Volunteers are great and they are super helpful, but having the staff backing really matters. So for us, fully funding the program where we can actually have a professionalized staff that is across the state of New York, that is working with the volunteers and working with the nursing homes to meet this commitment to go as often as possible. We are not meeting any of that right now. Very few facilities across the state. So fully professionalizing it, the ask is $15 million. We've sort of bumped it up every year gradually. I think it's great, but I do think we are at this point, given the demographics of our older New York population, that it is time to really just professionalize the long-term care ombudsman program to make sure that we are meeting the needs of everybody who lives in these facilities and that we're creating that really strong network that helps build that trust and really creates a sense of advocacy when talking about, for me, even things that rise up to real safety concerns and health concerns. So we've seen it be successful when it works. Really ensuring that it works everywhere is the next step.
Mm-hmm. Then following up on that, kind of the state of play there, my understanding is the governor has been supportive coming into this year. Do you have a sense of, where the two houses stand, what you think we'll actually get in the budget at this point?
It had, like I said, it's been incremental, where it's been $1 million, $1.5 million add-on every year. We got a big $5 million bump a little while ago. I think there is a healthy understanding now of the program and why we really need to look at taking it to this next level where we're ensuring all the resources are there. As in all New York State budget things, sometimes it's just a matter of continuing to beat the drum every year and saying, okay, this is great. We've also, chatted about this in budget hearings with our with the director of the Office of the Aging, and he has said, ramping up staff has been hard, so the slower approach in their mind works. I'm not sure. I think we can do both. So for me, it's really making that commitment and pushing as hard as we can, ensuring people understand that our older New Yorkers are our largest growing demographic in New York State, and often our highest paying taxpayers, and really, we really need to be investing in the services that make a difference in their lives.
Great. I did want to hit on one more issue before we get, well, we still have all three lawmakers here, and then we'll get to the other folks on our panel. Thank you for your patience. Another big issue that's got some momentum is putting enough resources in place to end the wait list for services for the aging. Last fall, AARP's Beth Finkel testified that up to 18,000 requests for services for older New Yorkers and their family caregivers have been on hold due to inadequate funding for the expanded in-home services and elderly program. AARP called on the governor to add, I think, $42 million to ISIP to eliminate wait lists. And I think we've seen some momentum there as well, some support in the governor's proposed budget earlier this year. And I guess let's pivot back to Senator Comrie. Have you paid much attention to this issue, and what's your view on what should be done here? And I think you're on mute, Senator. Oh, sorry.
So what was the question?
Oh yeah, talking about increased funding for the expanded in-home services for the elderly program. There's this wait list
Yes.
for
Yes.
services for the aging, and an effort to add more funding to
Yes, we've been trying to do that, and we've been also trying to change the specifics on it, because a lot of folks that need 24-hour care are not getting it. And we have a lot of folks that are hurt. We have a lot of folks that, as I said, because they're house rich and cash poor, they're telling them that our income is over, or and we need to change those dynamics as well, because a lot of those folks don't have support systems and they really need someone at the home. So, we're trying to make all those changes. I'm not sure we'll get that done in this budget. There's a lot to happen in the next couple of days, but we are definitely trying to make that case for a change. That can be an agency change that could actually happen after budget. So we're not going to give up, even if, April 1st comes and we have a handshake on the budget. This is a policy issue as well that I hope that other members will embrace, as they understand our aging population is critical. There's a critical need for them. And it's much cheaper for them to do it at home than to be in nursing homes or hospitals.
Okay. And either Senator Sanders or Assemblymember Clark, anything you'd want to add on this point?
I'd love to add a little. Senator Clear and I actually carry the legislation to clear the waiting lists. It's been something we've been pushing for years. The governor did put in her executive budget a $45 million bump to this program, which is in line with what AARP has asked for, and we are so excited to see this huge influx of dollars. I think our biggest concern now is that our numbers are sort of in flux as to what it would actually cost to clear the waiting list, because so many of our community partners that do these services for our older New Yorkers, their costs have gone up. So what's happening is this $45 million may not quite get us where we really want to go at this point, which is ensuring everyone who qualifies for these services is getting them. But we really need to be in touch. This is something I brought up in the budget hearing with the Office of the Aging and others, of saying, are we really listening to our community partners about what the cost is for them right now? All costs have gone up. Are we really dedicated? If we're just saying we want to clear the waiting list, let's bump up to the higher number. And if we don't end up needing it, that's great. But our numbers have had even upwards of over $80 million to fully clear the wait list. So that is something I'm continuing to advocate on the Assembly side. And I know that if we could get there and we could really ensure that our community partners have the resources to do this, we'll make a difference in the lives of 18,000 people.
Let me join in by applauding the governor and for getting close to what AARP has been pushing for and what we've been pushing for. I think that these are positive steps. But let me also remind us that a budget is merely a document which says what is the political will? Where are we going and what are we all about? When you speak of a budget, and 45 million sounds good, but then you have to look at the subsidies that we are wasting in different parts of our economy. And if we were merely to move those monies that are not returning a one-to-one investment and put them into our elders and other areas that have a billion-to-one in return on investment, I think that we would be a better society, and that I will remind us all, a budget is a reflection of our political will, what we believe is important, what we believe should be. These are our values, and we need to not simply speak of our great elders, the greatest generation and others, but we need to live our values, and we can take the money from wasted subsidies and move it to productive elders.
Great. Thank you, Senator. And Senator Connery, I want to get one last question over to you before you have to run. You've also introduced, I think just recently, the Fostering Affordability and Integrity Through Responsible Business Practices, or the Fair Business Practices Act. Can you just give a little brief on that? And is that something that could get done this session?
I hope so. Now, it's not the first time that I've introduced it. We've reformulated it to try to make it less injurious, because unfortunately the business community has been lobbying furiously against it. But the Fair Business Act is something that I'm working with our Attorney General's office, and it's part of her major focus for the last 2 years. Unfortunately, the governor has been vetoing the bill, but I think this time we have what we have. What we have presented is going to be a lot fairer to getting it done. The Fair Business Act simply is to make sure that all businesses treat people with clarity, and there's an opportunity for people to do returns or get reimbursed when a business rips them off. We have a lot of the bill is going to protect consumers from unfair, deceptive, and abusive practices. We have a lot of New Yorkers that are, first-time homeowners, first-time apartment owners. They're buying products that they're winding up getting ripped off for. They're buying deceptive products, and this is just something to help people when they have a major purchase, or that they can be able to get a fair opportunity to get reimbursed for them. So that's all it is. Unfortunately, the business community has made it that it's going to be a trip and fall thing, and it'll be a lawyer's panacea, which is not true. This is really going after unfair businesses, people that have been truly deceptive in their practice, and the AG is keen on getting this done. So I hope that the governor will understand that we're not trying to create opportunities for people to fall at McDonald's and sue, or fall at the Stop and Shop and sue, but these are for people that are purchasing products that they find out, or purchasing goods and services that they found out is a sham.
Got it. Great. Thank you, Senator. And we may circle back to that issue a little bit later in the discussion. I do want to get to Anne Marie Cook.
I'm sorry, I got to jump off, and hopefully I can come back before you guys are done, but I have a hard 10:30 that I have to be at. Thank you.
Senator, appreciate your time. We'll go over to Anne Marie Cook, President and CEO of Lifespan of Greater Rochester. We've heard a considerable amount from the lawmakers here, but as a head of an aging services provider in upstate New York, what perspective do you bring to some of these issues, and what are your top priorities in Albany right now?
Yeah, thank you so much. While we serve the Finger Lakes region of New York, we actually have several statewide programs. We operate the New York State Coalition on Elder Abuse and the New York State Caregiving and Respite Coalition. So as you heard me, or may have seen me, nod my head at each speaker, because so much of what they said I completely agree with. I would say there's a few priorities that we have seen that older adults have, and I want to start with some of the comments Jonathan made. We are seeing older adults honestly struggling just to get by each day, and we are seeing more and more older adults in poverty. And they are really struggling right now in terms of just trying to get benefit access. So we've been very focused on trying to work directly with older adults to get them connected to benefits. And certainly the waiting list for services has not helped. Once again, I want to jump on the bandwagon and thank the governor for her historic amount of money in the budget to reduce the waiting list, but I agree with Assemblymember Clark. It's really closer to $80 million when you add in the money we need for core services. So we need that money. A second priority I have is restoring money for elder abuse prevention. This isn't even adding money. Just a few statistics, over 300,000 older New Yorkers will be abused this year. Most of it will go hidden from the public. Only 1 in 24 cases is ever reported. And the most common form of abuse is financial exploitation, like Senator Sanders says, but we all know that it often leads to other forms of abuse, including physical abuse for individuals. We have to restore that funding to help intervene directly on those older adults who are being abused, train other people to recognize abuse, and educate older adults about their options. I would say a couple other priorities are scams prevention. I have never seen since COVID such an explosion in scams. And in fact, I saw a statistic the other day where 80% of older adults who are targeted for scams have either been a victim of a scam or someone tried to scam them. 80% of all older adults. We're asking in the budget for additional money to educate older adults about what to do if they're scammed, how to stop that scam, who to call, and we can help them. But once an older adult's been a victim of a scam, they will target them again and again and again. And I know in our region, I will just say, we have seen everything from older adults losing $100, which for many older adults is a lot of money, all the way up to $970,000 through scams. It is a scamdemic. I don't know what else to call it. I've never seen such a problem. And we need to add money to this budget to educate older adults about scams. Finally, of course, I agree about we have got to professionalize the long-term care ombudsman program. That is critical for older adults to have an advocate who reside in long-term care. And finally, we also have to add money for guardianship to support nonprofits who work with older adults who have been deemed incapacitated so they can remain in the community and thrive with that kind of support. Without it, many are struggling. There's been a lot of articles about inappropriate guardians out there, and we need to look at that program throughout New York State. Thank you.
Thank you. Just a quick follow-up for you. You mentioned professionalizing the long-term care ombudsman program. What exactly do you mean by that? What would you like to see happen there?
Well, as Assemblymember Clark said, many of the ombudsmen are wonderful volunteers, but they are volunteers. And so it's almost impossible to get the time in each long-term care facility we need every single week to build those relationships to ensure the quality of care and quality of life for older adults living in long-term care. When we have these programs that are on the backs of volunteers, honestly, it's very difficult to tackle some of these issues, and we need more paid staff out there for some very serious issues that are going on in long-term care.
Great. Thank you. And last, I want to get to Kristen McManus, Associate State Director at AARP New York. Obviously, you know these issues inside and out, but what else can you add that we haven't hit on directly? Is there any, you want to elaborate on any of these issues further, Kristen?
Sure, thanks. And I just want to say that I'm so grateful to all the legislators who were able to join us today, as well as Anne Marie and Jonathan for providing your invaluable perspective. I really appreciate all the comments that have come before me. I just want to piggyback on something that Anne Marie was talking about when we see what she's calling a brilliant term, the scamdemic. If current trends continue, according to the FBI data, older New Yorkers stand to lose $23,000 an hour to scams. That's over $200 million a year. And again, this is just what we know of. This is just the fraud and scams that are reported. So Senator Sanders, I really appreciate your comments on the budget proposal to allow bank tellers to pause a transaction if they think an older adult is being financially exploited. We completely agree with what Anne Marie is saying, that the education and the training is essential. AARP does our own scams education and training, but so many of these scammers are sophisticated, and you can be trained and prepared and aware of all of the scams that are there, but you have no idea how you're going to react when it's 2 a.m. and you get a phone call from somebody that sounds exactly like your grandchild telling you that they are having an emergency and they need cash from you right away. Was all of that training and preparation goes out of the window. And we need somebody who can objectively look at this older adult, what they are trying to do at the bank counter, and say, this is weird. This is really unusual behavior for this individual. They are not banking the way that they usually do. And I think they're encountering a problem, and let them intervene before that money is gone forever, and let law enforcement come in and investigate so they can also prevent other people from being scammed. I think this is one of the most essential things that we need to do to protect the financial security of older New Yorkers in this budget cycle.
Great. Thank you, Kristen. I want to actually ask you again also as well about the this effort to end the wait list for services for the aging population. I think probably all of you are, were aware of this for a long time. I think COVID for a lot of the general population, really drew attention to our nursing homes and the benefits of frankly staying out of a nursing home as long as you can. Can you talk a little bit about how, these services can keep people out of nursing homes for a longer period?
Yeah, absolutely. And we know that that's the case because the State Office for the Aging has reported that. When people are on these waiting lists, they're at risk of falling or getting injured or going into the hospital or going into a nursing home because they don't have the care that they need to watch them at home. So we also know that it saves the state money by delaying or preventing somebody entering into an institutional setting where they'll likely require Medicaid. But even more importantly, which we haven't discussed as much today, is the help that this gives for family members who are caring for their aging loved ones. Every time that somebody can come by and deliver a meal for your mom, that's one less meal that you have to make. And that's more time that you have to take care of your own business. And it helps prevent these family caregivers from being burnt out. Family caregivers contribute like $30 billion in unpaid care in the state. And it's really beneficial to all of us to make sure that they're able to continue providing this care for their aging loved ones and that they don't get burnt out and that they don't have to take a back seat and send an older adult into an institution just because they can't perform their caregiving tasks anymore.
And I want to open up to the panel as a whole. I've just been reading up on, so we heard from Senator Comrie about the Fair Business Act, and some of the context there is the potential impact of the closure of the Federal Consumer Financial Protection Bureau. The Trump administration has sought to do that. I think there's been some holdup in the courts on that front. But in general, with what's going on in Washington, can state government fill the gap to protect, not just seniors, but all types of New Yorkers at this time? And actually, hey, Senator Comrie's back. Maybe we'll go to you to start on that follow-up point.
Well, we have the banking committee chair that can make up all the deficits on federal dollars.
I was going to
No,
say
we
the
cannot.
Senate was going to make up all the.
No, we cannot. We cannot make up federal deficits. I was at a CDFI meeting yesterday to visit somebody. Their ask went from 1 million to 20 million. It's crazy. We can't make up $20 million deficits on the state level. What we can do is work with groups to try to push back on the federal level and not allow this to happen, and inform our residents and constituents that the federal level is trying to ruin their lives. But we're gonna be in pain for the next 12 to 18 months. Hopefully it ends in 18 months and people really wake up and understand the impact of this person trying to deliberately ruin government for working people and ruin opportunities. But we can't make up those numbers.
Yeah,
Let me join my colleague in his dire assessment, although I thought that his committee was going to be in charge of resolving this whole issue. I will say that the state government is going to have to really focus on what are the essential things that we have to keep going. We should be taking a worst case analysis, and we should be assuming that these cuts are coming, and what are the engines that we have to keep revving in New York? What are the things that will be produce the greatest good for the greatest number? And the senator is right. We have to fight. We have to ensure that New Yorkers get everything they deserve, even as we have a full throttled attack on the predators among us, those uh, who seem to exist to take what little our seniors have and the rest of us have and to ruin our lives. So we have to do both. Focus on what is critical. Make sure that the predators know that New York is no place to do business. And speaking of doing business, I'm glad the senator is back because I have to go. I'll take his place on the front line while he is here with you. I want to thank you for this opportunity, and I certainly want to thank AARP, City and State, and all of these great fighters that you have gotten together at one place. These are true heroes, and I'm proud to be in their number. Thank you very much.
Great. Thank you, Senator Sanders. Appreciate your time.
I'm happy to jump in, not that I want to pile on. Well, I mean, I actually do want to pile on the direness of this because it is really going to impact every single person in the state of New York. It's not just the Consumer Financial Protection Bureau, which honestly had gotten really aggressive for consumers during the Biden administration and had really great wins, ensuring that, as we call them, the little people fighting big business and Goliath and being taken advantage of, and all of these things really had sided with consumers and customers to ensure they were protected. So to see that go really is a slap in the face to everyone who's trying to, get by anywhere in the state or in our country. We cannot fill that void, but we can be aggressive with scams and frauds, which I think includes resources, includes more education and training. The bank bill to really look at I think it's a great tool that we can have in the state of New York. And I'm really excited to see that get to the finish line because it does allow for the pausing of financial transactions, but it's, educating for that example that Kristen talked about is, the thing we've done in our families, create a safe word, right? So that if your grandchildren and children don't say that word, then it's not that person and it's a scam. So there are things that we can be aggressive on, but it's not just it's not just the Consumer Financial Protection Bureau. It's our food banks that have just taken a huge hit. We're waiting for cuts on SNAP and Medicaid and all these other programs that are going to decimate people's daily lives. We've already seen it on prescription drugs. They've shot back up the costs of them for very life-saving medicines across the state. But here in New York, we're really still trying to cap insulin and we're trying to cap some of these programs. We cannot do it all. We are not, our reach is not as big. It is a huge piece of our budget every year. So it is going to be painful for many.
Great. Thank you, Senator. Anyone else want to wait? Jonathan Bowles? Yeah, I'll read back to you. Great.
Yeah, thanks so much. I certainly agree with Senator Comrie when he says that New York State can't make up for everything that we're losing from the federal government in terms of money. But I want to also kind of come back to what I said at the beginning. There are few kind of parts of our population that have a stronger case to make for greater investment right now. Again, 18% of the state's population are older adults today. The number of older adults have increased 30% in the past decade. We've seen so many other populations decline, right? We've seen this 50% increase in older adults living in poverty, right? Like if there was a case for like kind of greater investment, it's this. And we know that despite some really smart and important investments that people on the panel, our senators and assembly members have been talking about, and the governor committed to earlier this year, we haven't seen what's needed given the demographic boom that we're seeing. We've had a long-standing underinvestment in older adult services, or at least let's just say older adult services and investments for older adults just haven't kept pace with the population growth that we've been seeing here. Also, let me say that there are things that we can do in New York State to support older adults that go beyond merely kind of committing money. So one of the things that we've called for, and I know AARP has called for in recent years, is around a campaign or using technology to make sure people across the state who are eligible for benefits actually enroll in them. Right? There's a lot of people that are eligible for federal benefits and state benefits that could be putting money in their pocket, and they're not taking advantage of them. Many just don't know about them. So there could be a campaign that is helping people do that. There are also things when it comes to like the earned income tax credit. Right now, older adults, because of a federal requirement, are not able to take advantage of the EITC in New York. That's because of a federal rule. But as our data showed from the report we did a few months ago, we've seen a significant increase in older New Yorkers that are working past retirement age, past the age of 65. That's going to continue because of the financial security issues that we mentioned earlier. So let's make sure that more of these 65 and over New Yorkers are able to take advantage of the tax credit that we have for everybody else that's working. And so it's a federal prohibition on older adults working that goes back before so many older adults were working. But there are things that we can do at a state level to make sure that there's an EITC for New York State for people 65 and over.
And following up on your point of, signing up for benefits that are there and just kind of getting the word out, is there any other mechanism you could see to streamline processes for people to get access to benefits they might not know about? Or
Well, I'll let Kristen maybe, because I know AARP has talked a lot about a match where kind of if you sign up for certain benefits, you automatically kind of get enrolled for others. We have the technology to do that today. Kristen?
Yeah, thanks, Jonathan, and thank you for those comments. We know that if you're eligible for one benefit, you're likely eligible for many others because the eligibility requirements and income requirements are similar. We want to make it as easy as possible for there to be a one-stop shop. You find all of the benefits that you're eligible for. You can easily enroll. If you're receiving benefits from one program, can the state find a way to automatically enroll you into other programs that you're eligible for? Are there ways that we can make sure that people are getting all of the benefits that they deserve? Because the other thing is not just that it relates to the financial security of those who are receiving those benefits, but we know that this generates local income activity. We know that when you spend $1 on SNAP, it's at least $1.50 that's directly to the community, because the people who are receiving these benefits are going out and spending that money. They're not stashing away these funds in their mattress. They are going out and they are making purchases and they are contributing to the local economy. So we think it's crucially important that we look at removing as many barriers as we can to doing this data matching and making sure that people are enrolled in as many programs as they're eligible for, to protect their own financial security, but also for the greater financial security of the state. It's leaving federal dollars on the table.
I just want to add to that point, because we help so many people connect to services. I want to thank AARP. I totally support your efforts to kind of match these benefits. I will also have to say, though, many older adults cannot access these benefits without the support of the Aging Service Network. One, they don't even know they exist. Two, many of them don't have computers or even internet access we see in the rural communities. So without a social worker helping them do this, it's almost impossible for some to access. So a little bit of help makes a huge difference in older adults' lives.
then, Anne Marie, anything you would want to say about the federal impact, the shift of power in Washington, any impact you're seeing, or are you more really kind of focused on the state level?
Well, we're certainly focused at all levels. I have to say, if the Medicaid cuts go through at the federal level, I think they will impact all older adults in many different ways, and certainly impact the state. But this consumer protections that we've just lost at the federal level is very concerning. As I talked about how older adults are being scammed and financially exploited, and certainly deceptive practices happening, and not having those kind of protections is really a huge problem for older adults. I don't know if they see it, but certainly we see that. And of course, we're concerned about always the solvency of Social Security and Medicare, and Recently, I saw that the federal government is going to take down the phone line in Social Security. We're very concerned about that here because many older adults, especially those, once again, living in the rural communities, don't have easy access to a Social Security office. They don't have computers. We're just trying to brace of how we can help more and more older adults who need access to Social Security get that access, putting more strain on the aging service network throughout New York.
Well, again, here in New York, a lot of these policies are driven by the governor. We've heard about, various bills and we support this funding, does she not? Certain legislation. I guess, again, closer to home, how well has the governor been doing? If you could give her a letter grade or perhaps describe more qualitatively. And let's start with the lawmakers. Senator Comrie, and again, you mentioned the CDPAP program as one, maybe strike against the governor from your perspective, but overall, how is the governor doing?
I would leave that to the advocates, to be honest, to give her a grade as opposed to me. I'm focused on specific issues. I don't like where she is on the CDPAP. I think she's got her head in the sand because they took a bad contract. Her staff made her take a bad contract because this is actually a layover from the worst governor we ever had that she succeeded. But that's a whole nother story. She inherited the CDPAP thing. I think her staff has led her wrong on this. I think that there's an opportunity to see her improve all the way around. But unfortunately, I would blame more her staff than her on the CDPAP mess because she inherited it from the previous administration.
Are there any other issues you feel like the governor is doing well on? Any high marks you would give her?
Again, I'll defer on saying one thing or another. I'm not in I think the consumer needs to make sure that they're reviewing these things and looking at how the governor is and speak up more. We're in a stage where we need more agitation from consumers. We just can't have, and from our senior community, they don't have to physically be here, but they can, forcefully be here in other ways. If they can come up to Albany to demonstrate their agitation, but they can go to their local members' offices all over the state and let them know what's going on. They can send emails and outreach to the governor and let them know what's going on. We can't be quiet anymore. The silent majority has to step up to make change in the state.
Thank you, Senator. Senator Clark?
Sure. I mean, I think it's hard to give a grade because there's so many different programs out there, some doing better than others, as we've heard, especially you look at wait lists. I mean, that's a huge first time ever that we've seen a big commitment to put in a huge influx of dollars to help clear the wait lists that we know is important. But there's other programs you're looking at what we're dealing with CDPAP and others where we're still not quite there yet. Well, CDPAP is really a struggle right now for many, but other programs like long-term care ombudsman where we're not quite where we need to be. I think the governor's made a commitment to the master plan on aging. How that actually gets, funded, where the resources go. I mean, I still think that the services we provide for older New Yorkers, the dollars that come out of our budget that every year is such a tiny, 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 minuscule percentage, yet it is the largest growing demographic in our state. It is the largest demographic that is struggling with poverty and going into poverty for many reasons. So when we also, and I know AARP has done a great job of doing this, at looking at the amount of public dollars that our older New Yorkers pay every year, and they're not getting their bang for their dollars that they really deserve. And so we have not prioritized enough the money that we need to ensure people are living and thriving in their older years. We can do better. And I think we really need to keep sort of beating that drum all together as we look at it. I have looked at things from what Lightspan has done in terms of healthcare dollars, is looking at the connected care community. I'm saying it wrong, Anne-Marie. Connected care communities.
Community care connections.
Community care connections, where we're using Medicaid dollars preventively to do casework services and check-ins, and it actually saves money in the long run, right? We keep people out of hospitals, we keep people out of facilities. Like, why aren't we doubling down on things like programs like that actually save the state money? Why are we not really looking at scams right now? We know the more we can keep money in people's pockets, the better off they're going to be. Like, there's so many ways that if we just double down on a few things, and it is not terribly expensive in comparison to the entire budget, but we can make a difference in people's everyday life to afford the things that they need. Property taxes has become something that I've really started to dive deep into. I think one of the changes the governor suggested in her budget this year to align enhanced STAR payments back to residents at the same time town and city taxes are due, I think is really, really smart, because that has been an issue where you're not getting your refund in time. So you're paying out in taxes before you get the relief. So even some of it doesn't cost money, but I think we need to do more, because people, particularly upstate and Long Island and other places where there's a lot of home ownership, property taxes is really pitting older New Yorkers against families with kids and other things when it comes to school board votes and all these other instances where we're relying heavily on property taxes, yet people are getting run out of their homes because they live on fixed incomes and can't afford a huge increase monthly to pay when their property taxes go up. So we really need to continue to look at making sure affordability, access, and being smart about how we spend our dollars. We can ensure that every New Yorker, every older New Yorker really thrives and stays in our state, because it is quite beautiful. So we got a lot of work ahead, but we're getting there.
Thank you so much. Anne Marie, over to you.
Well, I would just say, as everybody else said, I give the governor a lot of credit for doing this historic investment in terms of the waiting list, but there's so much more to do. And I do recognize in some aspects, it's like turning the Titanic in a bathtub. But when you look at a few more stats, 43% of our tax base are older adults, yet the New York State Office for Aging budget is less than 1%. I don't think we can ignore anymore that there is changing demographics, and that older adults are really providing a lot to the community, not only tax-based, but volunteerism and the caregiving that Kristen talked about, that, for older adults. But we see more and more older adults needing services each year, and we've largely ignored the Office for Aging budget and largely ignored investments in older adults. We're paying the price right now, and we really need more support so those older adults can thrive in the community.
Great, thank you, Anne Marie. Jonathan, any final points from you?
Yeah, I mean, I would agree with what Anne Marie said. I mean, I think, like, if I had to give a grade, which I'm not really prepared to do, but I'll say, I think that what the governor did this January, that commitment to end the waiting list, I think is a good A or A minus. But I think overall, I think that the state, which is the governor, the legislature, and going back for years, probably deserves at best a C or a C minus, and just keeping pace with this kind of rapidly growing population. The needs are severe. They're only getting more intense. And like I said, I feel like we have this financial security crisis. I mean, look, we've heard all around the state, that we've got this affordability crisis in New York. I mean, ever since the election, especially, it's pretty much everything everybody's talking about. There's hardly any group that's facing it more severely as our older adults, but we haven't yet seen the kind of response around older adults. And so we're getting there, and this panel's been great, and we know we have some amazing allies in the legislature, but there's so much more to be done. And that's why I think, like, at best, a C in terms of how our state has really responded.
Great, thank you, Jonathan. And Kristen, we have a little over a minute left, if you want to
Sure,
close it out.
thanks. Well, AARP is a nonpartisan organization. We work well with all elected officials of both parties, and there are certainly policies that we support and policies that we are working to improve. I think this has been a really great discussion. I just want to close again by asking that we include the funding for HCBS in the budget. We include funding for LitCop in the budget. We allow bank tellers to stop scammers in their tracks. And lastly, I would ask everybody to go to aarp.org/social security. You can see all the work that we are doing to protect the financial security of older adults, and you can join in the fight. We've had almost 1 million contacts generated with members of Congress in both houses. So thank you. Thanks to everybody for joining us.
Great, thank you, Kristen. Thank you to all of our panelists. Thank you to AARP for partnering with us on this. Thank you to everyone who tuned in today to the program. Hope you learned something. I certainly did. And that concludes the program. Thanks.
Thank
Stay
you.
safe, everybody. Stay safe. Be advocates. Thank you all.
Thanks.